guys, it's Khaki. I wanted to do a little update video on my plastic surgery journey following, of course, bariatric surgery. I had a gastric bypass in November of 2022, and I have lost anywhere from 142 to 146, 47 pounds depending on the day. About a year ago, I had an extended tummy tuck and an extended brachioplasty or arm lift. Then about 4 months ago, I had a breast lift without implants and then a bra line back lift. So for those of you who are interested in plastics and would maybe like to see the status of my healing after surgery at this point, here we go. First off, let me show you my arms. Let me tell you though, before I had lost any weight, I have never worn short sleeves, ever. I was one of those people that I always had to have a shirt that hit me at least at the elbow. It didn't matter how hot it was. I was so self-conscious of my arms. After I lost weight, it was even worse. I could fit in smaller clothes, but I was having to buy a larger size just because of my arms. And the pendulous hanging skin was terrible. So I'm going to insert a little clip here before my surgery, my arm lift, to kind of show you where I started. And then I'll be back. Okay, so this is your quintessential in the bathroom pic. I don't know any other way to do it except in the mirror. So I'm going to talk about my arms first. As you can see, I have a lot of loose skin on my arms on both sides. You can see that. I'll kind of lift them both up. So with the arm lift, all this extra stuff, it's going to start up in the armpit area and then go down to the elbow. You do have a pretty considerable scar, but it's not visible when your arms are up against your body. I mean, if you're raising your arms up, you will be able to see it, but I doubt I'll be doing that very, very often. Okay, so this is where I'm at now, about a year out. I think it looks great. As you can see, I do have scars. I think they have healed really well. But just in your average day-to-day, how often are you going to have your arms up like this? Just wearing short sleeves. I do still have a little jiggle. That's natural. But just wearing short sleeves, I feel great. This is what I wore this morning to bar or Pilates class. I'm comfortable wearing this to class. Prior to this surgery, even at exercise, I still wore t-shirts. So I think overall, my arm lift has made the biggest impact on my self-confidence. Being able to wear short sleeves was a game changer for me. So first, I'm going to show you my tummy. I do want to put in a video that I made immediately before my tummy tuck so you can see kind of to compare. Okay, so now talking about the abdomen, I'm going to step a little bit back. As you can see, I have quite a bit of loose skin. I'm going to turn to the side so you can see this. It does go around to the back as well. I've got on a Freestyle Libre, as I talked about in a earlier video. I do have some reactive hypoglycemia when I eat simple carbs, so I just keep that on to kind of give me some warning of when it's going to happen. My scar will be, the incision will be all across the pelvic area, and will go, he said, to about right there. So all this is going to be basically taken off, and then the skin of the upper abdomen is pulled down over the lower abdomen. Your belly button stays in the same place. They just make a new opening on top of the skin. So there we go. We'll see what this looks like in a few months. I know it takes a long time for the swelling to go down. So let me show you where I'm at now. Try to get this down as low as possible so you can see. And of course I've got these pants on that are kind of digging in, but you can kind of see where I'm at. My tummy is not flat. I mean, I think that's very unrealistic. But when I lay down and put my hand on my stomach, it's like, oh my gosh, my stomach is flat. So as you can see, I don't have that loose hanging skin anymore. My scar does go all the way around to the back. One thing I think is really important when you're looking at skin removal or plastic surgery after a massive weight loss, you're not going to have a perfect body. It's not realistic. What you're looking for and what you really should be hoping for is the best that your body can be. I think a lot of people go into this process sometimes with a little unrealistic expectation. You're probably not going to have that flat abdomen. You're not going to have perfect breasts. You're not going to have perfect arms. But you are going to have the body, hopefully, after you get done with this journey, that suits you, that makes you feel better. So, upper back. I had the upper back lift, same time that I had the breast lift. I'm going to put in a video here. This was actually made at 4 a.m. the morning of surgery. So you can see where I'm at with that. Okay, guys, I hope you can see this. This area right here is what we're going to be working on today. The front looks good where I had the tummy tuck, but when I wear clothing, and of course I've got my arm up now, so it's making it a little bit less obvious. But when it's down, this really shows in shirts. And it really bothers me. I mean, it can really, it kind of directs what shirts that I wear. And I feel like I have worked so hard on getting my weight off. I don't like this extra skin. And I do get rashes under it. It's very pendulous. So that's what we're going to be getting rid of today. All right, so I'm going to try to back up enough that you can get a full back image. I'm going to pull this up. Now, you can see my scars. I'm going to get a little bit closer so you can see them a little better. Of course, they're in a different state of healing. These scars do go all the way around to my breast lift. I'm going to step a couple of steps out so you can see where I had those puddles. I don't have puddles anymore. I have a smooth back. And my clothes fit so much better now than they used to. I can wear a shirt that's fitted and not have to worry about that loose skin and being so self-conscious about it. As far as the breast, of course, I can't show you that, but I can tell you before this journey started, before I had weight loss surgery and lost weight, I was about a 44D, double D. After I lost weight, I was about a 38C, but most of that was loose skin. Now, with everything shifted up, I did not have implants. I'm at about a 34C. And it is breast tissue. It's not skin. Everything looks great. Everything is healing well. I could technically go without a bra. I'm not comfortable with that. You know, no judgment if you are, but that's just my comfort level. I think everything looks great. A lot of times I get asked if I could not have had the skin removal, would I have still had the weight loss surgery and the hopefully weight loss? Absolutely. This is the cherry on top of the cake. This was not necessary. While I did have some skin rashes, some skin breakdown, especially around my back and under my abdomen, I was dealing with that. I never went into this journey thinking that I was going to be able to have skin removal surgery. I remember my sister, when I started losing weight, my sister that's a registered nurse and that helped me in my post-op recovery said, do you think you'll ever want to have one of those skin removals like I see on my 600-pound life? And I said, hell no. Never thought I'd do it. Then as the weight started coming off and started revealing the loose skin, that's another thing that people have to understand. The weight loss didn't cause the loose skin. The excess fat did. The weight loss just reveals it. But when that skin started to be revealed, I started thinking, well, maybe I will. I went and got a consult from 3 different surgeons. Went with the one that I was the most comfortable with. He was middle price. I did try to get insurance to cover a paniculectomy. It declined. So my advice for anybody who thinks they might even consider this, go get a consult. Find out what you're looking at price-wise, if insurance will pay for any of it. Kind of get that in your mind. Start planning ahead if that's something you think you want to do. But if not, that's okay too. So guys, I hope everybody has a great week. I would love to hear video suggestions. I have got some good ones coming up that people have asked for. Would love to hear where you're at in your journey. Are you considering plastics? Is that something that you have checked with your insurance to see if maybe it would cover part of it? I just love to hear from everybody. I hope everybody has a great week. Bye.